Surgery, I was experiencing a lot of pain. I just thought that that was part of getting older. I'm 47 years old, so I thought that this is just how it went when you got to be my age. And the pain started getting worse and worse, and then at one point in time I woke up out of a dead sleep in the middle of the night with this just piercing pain where my ovaries are, and I thought to myself, this can't be right, and I thought I might actually have to come to the Chester County Hospital early. So it was at that point where I thought, you know, maybe I should go see a doctor. Maybe this really isn't normal and I shouldn't be in this much pain just because I'm 47 years old. I think what made me finally decide was the pain I was experiencing, that I needed to go and get it checked out. I was having lower back pain also, and also was really exhausted, like all the time. So I decided I should probably go and get a doctor's opinion instead of diagnosing myself, since I am not a doctor. My decision on who to go see, I did not have a OBGYN at that point in time. I just had a primary doctor. So I just asked around, and several of my friends recommended Dr. Christina Ellis. And I felt so fortunate to get into her office. I know she wasn't taking new patients at the time, but because of my symptoms and because I had a previous surgery to deal with some of these issues, she was willing to see me. And it was a match made in heaven. When I went to see her, she was very proactive, and right away she said to me, you should not be in this kind of pain. This is not normal at all, but don't worry. So she sent me out to have a pelvic ultrasound, just to kind of see what was going on, and things kind of picked up pace pretty rapidly and got a diagnosis. I had pretty large uterine fibroids in my uterus, and they thought also there was some endometrial tissue possibly around my ovaries, and that was what was causing all my pain. So it wasn't in my head, which was really nice. I wasn't just imagining things, and no, it was not a normal thing for somebody my age to be experiencing that much pain. Her solution that she recommended was Da Vinci robotic surgery, which I had not heard of before. And really that was my best bet, because I'm not far enough into menopause yet. So in order to wait for menopause to try to get rid of the problem, it was too many years in advance. I'd be in pain for too many years. So this seemed like the best option, and she did say that I was a good candidate based on the condition that I had. So she handed me a DVD and she said, you know, go home, watch this, check it out. If you have questions, let me know. So I went home and watched the DVD, and it made it sound really simple. And to be honest with you, when I looked at the testimonials on the DVD, I was like, they're just saying that to try to make me feel good. Because it said, you know, oh, you'll hardly experience any pain, and, you know, recovery is amazing. It's so much quicker than the traditional hysterectomy would be. And I remember thinking, oh, this is a marketing ploy. Boy, was I surprised when I was on the other side of the surgery. What a difference. Some of the concerns that I had before I had the surgery, it's going to sound ridiculous, but my brain just works a little differently. When I heard robotic surgery, I kind of was picturing like an assembly line with robotic arms that kind of like put parts together for cars and things like that. So I thought all the surgeon did was maybe program those robotic arms, and then they kind of ran through this program where they would do my surgery. And I thought, you know, what if they mess up? Like, what if my liver or my spleen goes missing instead of my uterus? And it just was, I was a little concerned about that. And, you know, I was concerned about recovery time. I was concerned about, you know, I mean, I've been married for almost 25 years, so I wasn't so concerned about what the scarring was going to be like. I figured, you know, I've been around long enough, he's going to keep me now. But, you know, it was still a concern as a woman. You know, I just wanted to know what kind of scarring I was anticipating and things like that. And pain levels. Those were the main things that I was concerned about. That I thought that maybe on the DVD that I had watched, they were kind of sugarcoating the surgery when I watched the DVD, but they weren't. I discovered that they were not. It's been 6.5 weeks since my surgery. I just went back to work on Friday. I worked a full shift on Friday and Saturday, and I also worked yesterday. And I feel really good. I'm not in any pain at all. Pain from the surgery, or obviously the pain that I had that caused me to have surgery, is gone because those pain-inducing objects are no longer in my body. And I feel really good. I'm getting stronger every day. I have more and more energy. I'm able to things that I thought I wasn't going to be able to do for maybe like another 3 months. Like I'm looking forward to, believe it or not, the next warm day we have, I'm going kayaking with my husband. So I will be helping him put the kayak on top of the van, and then I will be, sorry, I'm moving a lot. I'll be doing this motion in the kayak. I have no, like there's no pain. There's none, which is amazing to me. And my incisions, which I will not show you because you don't need to see them, but they're so tiny. I have 4 half-inch incisions in like a little arcing rainbow shape, and then maybe 1-inch incision over my belly button, and that's it. And I just have these little itty bitty teeny tiny, they're so cute. Maybe I'll get a little tattoo on each of them, I don't know. I'm a mom. I have 2 daughters. One is 20, one is 16. I've been married for almost 25 years. And my day job that puts food on the table and gives me health benefits so that I could have this surgery done. I work as an optician, which I enjoy a lot. But I also, on the side, I love doing stand-up comedy. I'm a professional singer. I get paid to sing weddings, funerals, things like that. I try to be just an all-around cheerleader for humanity. If I had to give myself a title, that's what I would say. So I'm very active. I'm very busy, and part of the reason that I wanted to have this surgery is because the pain was kind of starting to infringe, and the exhaustion. It's hard to do stand-up comedy when all you want to do is go take a nap. So this has helped me to be able to kind of come back to the things that I love again, and be a better mom, and be there for my husband, and just be able to do all the things that I love again. So that's really, really exciting. My name's Sandi Chadwick, and on February 9th of 2012, I had Da Vinci robotic surgery at the chest